Hello, everyone. Thank you for joining in. We'll take another minute as everyone keeps joining in. Welcome to today's webinar, Integrating Culture and Care, Behavioral Health Approaches for Hispanic and Latino Populations. We are very grateful to be joined today by our speaker, Diane Arms, and very grateful as well to be bringing this webinar in collaboration with the Southeast MHTPC, who are joining us here today for this great and important presentation.
Let's get started. Good morning. Well, where I'm at, it's still morning. I know you all are probably already past noon. My name is Diane Arms, and I'm glad to be presenting this on behalf of the Hispanic Latino Behavior Health Center of Excellence and the Southeast MHTTC.
So, yes, Diane, sorry, I'll say this to everyone. We actually were hoping to present today with simultaneous translation, but what we'll be doing is for all our Spanish speakers is we'll most likely upload a video of today's presentation in Spanish as well for those of you who wish to listen to today's presentation in Spanish. So we apologize that we can bring it directly in Spanish translation today, but we hope to bring it forward in an uploaded video in one of our platform and website. Thank you.
Thank you, Eric. So to start, our mission at the Center of Excellence is to advance and support the sustainability of behavioral health equity by promoting community-driven, culturally grounded, and person-centered prevention, intervention, multiple pathways of recovery, and recovery supports for diverse Hispanic and Latina communities. So this is me, and you can read about me. I'll put my LinkedIn QR code up a little bit later, but I am, who am I? So I am a second generation Mexican American. My grandparents, who you see here, immigrated from Monterrey, Mexico, and they landed in El Paso. I now live in Houston, Texas, with my big Mexican, Bolivian, American family. But I'm also a number of other things. I'm an advocate, I'm a mentor, I'm bilingual, I'm a madrina, I'm a mom, I'm a Houstonian, I'm neurotypical. And I say that because my path and my views are that of all this, what has made me who I am. Um, Today, you are you. For those Dr. Seuss fans, today you are you. That is truer than true. There is no one alive who is youer than you. Our Latina population is incredibly diverse, and I just want to make sure that um, going into it, I use that disclaimer that my views and my stories are of that of a second generation Mexican American. In this presentation, I will most likely use the word Latina, but um, don't get mad if I switch it up a little bit. I'm used to using Latino. And so I'll use them interchangeably, but knowing that there is a difference and a reason why we use the word Latina. So here are our objectives. We have a full agenda. We were really kind of trying to get a lot of things in today, but we're going to go through some demographics and trends. We're going to explore cultural humility and the multi-culture. We're going to recognize common cultural values and norms, understand expressions of emotions and resilience, and apply culturally responsive approaches. And for those of you who have taken a webinar from me before, there will be a competition at the end for a Starbucks card that is provided by me, by my own money. It is not provided by the center, or it is not provided by SEMHTTC because their grants don't allow that. But I feel that this is great information, and a little competition never hurt anyone. So let's get started and jump right in. So nearly 64 million Latinos live in the US in 2022. And in the census data, in Hispanics were 19.1% of the US population, but it's estimated that by 2060, Hispanic and Latina population will grow up to 111.2 million people and be part of almost 28% of the population. The origins of US Latinos in 2022 were majority Mexican, followed by Puerto Rican, Salvadorian, Cuban, and Dominican. Like we said, this presentation is in collaboration with HHS Region 4, the Southeast Mental Health Technology Transfer Center. And here are the states that are including. So if you're joining us from those states, you actually get a couple slides that are just dedicated to you. But if not, it's important information all across the US. And within this region, Florida is actually the third largest Hispanic population in the United States, and Georgia actually comes in at 9. So big states. And I know that we're actually increasing in those areas as well. So the percent of Hispanic population growth in Region 4 of the US by state. So here we see North Carolina, Kentucky, Alabama. Looks like Tennessee may be the about 275% growth rate from 2000 to 2022. And although Florida has slowed, and it's only about 125% growth between 2000 and 2022, we know that Florida is also highly populated by the Latino community. And this is by county. And if you can see the colors on the key, it looks like following the US as well, Mexican is the majority ethnicity, followed by Cuban and Puerto Rican. Here, though, we look at how many mental health facilities with it and across the census tract that have Spanish-speaking communities have actually somebody who speaks Spanish. So the little crosses indicate the location of a specialty mental health care clinic that has services in Spanish. And as you can see, they're quite dispersed, but there's not that many of them. Of the area of Region 4, 13% identify as Hispanic or Latinx. About 6,400 individuals speak Spanish at home. And number-wise, 20% of the 736 counties in this region have one mental health facility. Only 20% have one mental health facility providing services in Spanish. So now if we pull back a little bit and past year mental illness among all Hispanic adults in the United States, the prevalence was highest among Hispanic youth aged 18 to 25 for both any mental illness and serious mental illness. And in the past year, major depressive episodes for Latinx 12 to 17, 1 in 5, which is about 20%, had an MDE, 3 in 4 had a severe impairment, and nearly 50% did not receive mental health treatment. Of those with severe impairment, 42 did not receive treatment. For 12 years and older, about 8.9 million individuals had a substance use disorder, but they did not receive treatment. So about 87.5% of that population. And we know that substance use treatment is harder to find than mental health treatment. And that's why it's so high. Major depressive episodes, 55.7% of the Hispanic Latino population did not receive treatment for their MDE. And then you can see the other, any mental illness, serious mental illness, and co-occurring disorder percentages of people who did not receive treatment for substance use. So it's pretty sad and it's a bleak, but we're here to help you change that and be advocates for the Hispanic Latina population and be better prepared to see them. And this just shows it that, individuals did not perceive the need for substance use treatment and could be one of the reasons why they're not seeking out. It all comes down to education. Okay, so let's get into the crux of what we're talking about. So the multicultural orientation framework explores how cultural dynamics between client and therapist influence the therapeutic process. And it builds on the multicultural competence counseling theory to really examine cultural intersections in therapy. While the MCC framework was very much about being competent, the MCO framework is more about being humble. There's three parts to it: cultural humility, cultural opportunity, and cultural comfort. And we'll go into these a little bit deeper. So cultural humility, the therapist is curious, open to different perspectives, and other-oriented. It is central to the MCO framework, serving as an alternative, again, to cultural competence. Definition of humility is it involves self-awareness. It's people understand their limitations, and it emphasizes being other oriented as opposed to being superior. People have an open mind and they tend to be more collaborative with their clients. Cultural opportunity, however, is where the therapist notices and addresses cultural themes in therapy when they arise. And this could be cultural opportunity or missed opportunity. So you recognize and seize the moment where clients' cultural beliefs or values become very apparent. So they can be nonverbal, their reaction to culturally specific questions or cues, or they can be verbal, talking about their practices. It is incredibly crucial for therapists to approach these conversations with sensitivity. And so, for example, if we have a white heterosexual woman in her 30s who was born and raised in Tennessee by a single mother, she has persistent depressive symptoms, maybe over 4 months. But how can we use the opportunity, the cultural opportunity, to engage and build the rapport with the client? One way is we can explore her cultural identity about being brought up in Tennessee. What does it mean to have been born there and have lived there and raised there? How does that impact their identity? Or we could use family dynamics. What did it feel like to have a single mother? What was that influence on this individual? We really need to emphasize understanding the client's depressive symptoms through her background, through her cultural background and values. So it's not just where the MCC was addressing just the depressive symptoms, it's also using cultural exploration to find out more than just the symptoms of that individual and what could be contributing. Cultural comfort, on the other side, is where the therapist, is calm and courageous when discussing cultural and identity. And it is basically what it says, right? It's a therapist's ability to engage comfortably and confidently, when having these discussions. It is incredibly important for supervision in these types of moments because you can come into some transference, some countertransference. You really have to be able to manage your reaction and or your discomfort. So in the example that I gave above, what if we say that the therapist is a Latino lesbian woman. Um, the therapist may fear that exploring the client's religious identity might lead to encountering heteronormative ideas, which could impact the therapy relationship. Um, there could be potential countertransference when talking about her personal discomfort or biases influencing the therapeutic process, and maybe even some prior experiences of the therapist can affect the current therapeutic approach. So it may be important to explore the client's religious identity in a way that maintains a constructive and empathetic therapeutic relationship. So let's talk a little bit about cultural values and norms. Mental health. La ropa sucia se lava en la casa. We always say this. That really means the dirty clothes is washed within the house. Latinos are very much a culture that does not like to air their dirty laundry because there's so much stigma with mental health. There's that fear of being labeled as crazy or bringing shame and unwanted attention to their families, especially in those families where you may have an undocumented aunt or uncle or grandma in the house. Our community tends to not want to rock the boat. So some of the values that impact the engagement that you'll have within the Latino community is the use of the Spanish language. Now, we know that there are translators, and I tend to use a lot of stories in my presentations because I think it drives the point home. When I was living in El Paso, we had I was overseeing a children's mental health clinic. And in that children's mental health clinic, predominantly Latino kids, a lot of the parents were monolingual Spanish. We had one psychiatrist for about 12,000 kiddos. We needed help. So we started using telehealth. The only individual we could get at the time, this was 10 years back, was an African American male from Dallas. And when I tell you that the rapport he had with our community was far surpassed even what the doctor that was Latino within our clinic had. While the use of the Spanish language is incredibly important, I want to say that we need allies and we need people. We're not going to be able to have every therapist, every psychiatrist, every psychologist, every social worker look and speak like us. So the use of Spanish language is incredibly important, and people should be able to receive services in their preferred language. And also, we know that there's still this huge gap of people understanding the Spanish language and being able to provide services in it. So translators can be incredibly important as long as they can show that empathy as well. Other cultural values that are important for Latinos is the importance of family and religion in daily life. Also, traditional gender roles, and we'll go through that, Mayanismo, machismo. Protocol in social relationships, which can frequently be more elaborate than in casual mainstream America. And then the personal nature of relationships, even business ones. So providers really need to be familiar with normative cultural values, have an understanding of their own beliefs, and be aware of the values that increase the client engagement. So one of the first values that we're going to talk about is confianza, trust. It's a form of mutual reciprocity, having faith that the individual will help you to the best of their ability based on the relationship. This reciprocity is expected within our community, but it also has to be earned. You can see why trust is such an important factor when a lot of individuals who have migrated have been through the ringer and have had probably experiences of where they had to put their trust in strangers and not had the best outcome. Um, Small self-disclosures may be helpful in establishing trust, and this kind of goes against usually what therapeutic processes entail. And you don't want to give too much, and of course, but when working with Latino clients, if you don't talk anything, if they don't know anything about you, the trust is not going to be there, and empathy and rapport will also not be there. So personalismo, friendliness, referring to how one behaves within relationships, the sincerity, the authenticity, the warmth. Um, we may have them come in and talk, have small talk. Physical contact is a huge thing, hugging, again, sharing personal information. They want to get to know you on a personal level. That that way they feel that they're not just the only ones divulging their, dirty laundry. And respect, it refers to the respect that's given to the professionals. Providers are often seen as authority figures, and the community may not want to question their recommendations, or they may just sit and nod and say, yeah, I'm going to do what you say, but because they don't want to ask why or say what's another option. So while there's respect is important, it's also important to understand that respect may be a barrier to getting all the information out of an individual. Familismo, obviously family, right? The client's focus of family and their community support. And this is exactly how people define their family. Our family is, the way I would define my family is my tias, my uncles, my aunts, my grandparents, even sometimes the neighbor that would come over for our family parties, the priest that would come to our family parties. So it's important to know that family to us is not just the nuclear family, the family that you were born in, but it's a much larger group. Also, boundaries within the family are very flexible and ever wavering. So we got to be careful in pathologizing relationships that may actually be supportive. In addition, family, we often put our family first, and so before the needs of ourselves. And so it's important to understand that if and not look down on that. Espiritualidad, spirituality, existential, transcendental aspects of life. Illness can be viewed as a spiritual punishment. And so it's incredibly important to know and to accept that your clients may not just be going to a therapist. They may have already tried a priest or a curandera or other religious leaders to try to fix their mental health issues. So again, spirituality is just is an important piece. And while religion may be a piece of that, it's not only religion, it's the relationship to God. So here we talk about cultural values that impact interactions, right? These are the three ones that really can impact the treatment phase, just because they're very pervasive, and their perception of what these values mean to them, and if they still carry them as strongly. So we'll start with machismo. It's a form of masculinity that involves having pride, being courageous and valorous, but it also promotes male dominance and superiority. Men with this value may struggle to accept appropriate emotions and vulnerability, and it may lead men to minimizing symptoms. I have a staff right now who is having some trouble because she is a female therapist and she has a Latino male who is coming into groups and wants to lead and wants to show dominance. And she's had to have that conversation with him. But she's had to have it in a understanding way of his culture and why he's trying to do what he's done because that's all he's seen is that male dominance piece. And she was had to navigate that while respecting his culture, also understanding that this behavior was impacting the groups. Marianismo is the female equivalent, and it incorporates saintliness, submissiveness, humility, vulnerability, having to raise children. Females with this value are more likely to minimize symptoms or neglect treatment to care for their families. This is also very a difficult barrier to overcome if an individual heavily believes or has this cultural value because they should not be doing any wrong. And there's a lot of guilt and shame if they aren't the saint, if they aren't submissive. And so this is something to absolutely watch out for with your client, with your female clients. Fatalismo. It's a belief that an individual's future and fate is beyond one's control. So it's really locus of control. Events are predetermined. You'll often hear, está en manos de Dios. It's in God's hands. So when individuals say that, or when individuals have that type of understanding or belief, it's a barrier to treatment because whatever's going to happen is going to happen, right? There's nothing that you can say. There's no treatment plan that you can do. There's no work in or out of the therapeutic room that can be done. So this is another one that we have to be very careful with. If somebody carries this value incredibly heavy, it may be a little bit more difficult to get them to see that there is control and they can change their behaviors. So we're going to talk a little bit about cultural concepts of distress. There's three different parts to this. We'll talk about cultural syndromes, idioms of distress, and then cultural explanations, which is the perceived causes of these syndromes or symptoms. So with cultural syndromes, it is involves groups of symptoms that only co-occur among individuals in specific cultural groups, communities, and contexts. So the focus really is on the symptom patterns, and it's specific to a cultural or ethnic group. And the purpose of these cultural syndromes is to identify clusters of symptoms that occur together in particular cultural contexts. So some of the Latina cultural syndromes is nervios. How many have you heard of nervios, right? It's a general state of vulnerability, distressful experience. It's a broad idiom that may be accompanied by somatic symptoms. And there's also ataque de nervios, characterized by symptoms of intense emotional upset, like could include anxiety, screaming, shouting, crying uncontrollably, inconsolable, trembling. And then we have susto, the cultural explanation for an illness that is frightening, a frightening event that causes the soul to leave, and it results in unhappiness or sickness, and some difficulties in social roles. And this can occur too with some somatic symptoms. And then we have, I'm sure you all have heard of this one, mal de ojo, transmitted by someone making eye contact with someone that's coveting something. So the instigator is coveting the child, or um, it's received through the eyes of the intended recipient, and this can cause multiple like gastrointestinal problems. And I'm sure you all have heard of the egg, or maybe you haven't, but there's a way to fix mal de ojo. Um, we won't get too much into that, but it does involve an egg, and yes, and there's also ways to ward against it. A red bracelet is one way to ward against the mal de ojo. So let's move on to cultural idioms of distress. Um, Hispanic and Latina persons may use expressions that are consistent with cultural bounds. So the focus is really the expression and communicative of the distress. Um, for example, nervios, it starts with a specific idea that is stuck, idea pegada en la mente. They might find it difficult to think about others, or even find that their thoughts are consistently returning. And then we also have coraje, which is anger. And it's the most infrequently researched idiom of distress. It may be related to nervios, depression, and some trauma. So cultural explanations. Many Latinas only go to the doctor when something is wrong and when pain is unbearable. And by this time, it may be too late. Many Latinas hold the cultural idea of personalismo. They expect, that personal contact with the provider who is diagnosing and treating their condition. So the focus of the cultural explanations really is the attributions and explanations for symptoms. Their beliefs and interpretations about the causes of distress within a culture. And this often, the purpose is that it offers culturally grounded reasons for why symptoms of distress are even present. So Latinx also expect to include family members in the relationship with their providers. So we have the application for therapy for concept of distress. Cultural syndromes really is useful for diagnosing and recognizing culturally specific patterns of symptoms. Idioms of distress is important for understanding the client's perspective and communication about their distress. And the cultural explanations or the perceived causes is really essential for understanding the client's explanatory framework, and then addressing their beliefs, the causes of distress. So before we get into treatment, using the cultural formulation interview through the DSM is a great way to help understand if some factors are actually related to the cultural, or if they are symptoms of a diagnosis. It's a set of 16 questions that you can use during an interview to assess the impact. And it hits 4 points: the cultural definition of the problem, cultural perceptions of cause, context, and support, and then cultural factors affecting self-coping and past help seeking, and cultural factors affecting current help seeking. So let's talk about interventions. When we're really talking with the client, we want to make sure that we are taking into consideration their concept of health, and their concept of distress and suffering. And then we also have to be aware of not just their cultural values, but also our own cultural values. What lens are we bringing into that therapeutic room that is causing us to look at this one way or another? And then also the diagnosis and assessment of the provider. Meeting the client where they are, really, you have to take a holistic viewpoint of all that. And there's a great way, a great framework model that we have available to us. It's the ecological validity model, and it's in 8 areas in which you can adapt treatments to be more effective with ethnically diverse clients. It's a holistic model, and it shows that culturally adapted interventions have lowered rates of premature dropouts. So let's start with language. Language includes the actual language, Spanish or English, but it also includes the local colloquialisms and idioms that impact the expression. Individuals are not likely to think of ideas which they cannot express within their culture, and knowledge of the language usually implies a greater cultural knowledge. It's important for Hispanic clients that they can express themselves, within the language that they're more comfortable. Dichos or idioms, just like that of si Dios dirá, the ropa sucia, can connect cultural metaphors with the client's experience to increase his or her understanding of treatment concepts. Language may also indicate acculturation or assimilation levels, and with that, you'll be able to see where the individual is in regards to their generation. Usually, further on generations become more acculturated and often lose the language. This impacts the therapeutic process, especially if you have an adolescent who only wants to speak English and their parents, can only speak Spanish. So while you have some specific modifications that you can have for language, like translation or interpretation, you want to make sure that you are clear with any language that is being stated, and even any language that isn't being stated. Naming or experiencing distress in their language. Another way that language can be used in the therapeutic process is narrative therapy, and it shows it's helpful when working with minority populations. So persons, the second piece to the ecological validity model. This concept refers to the individuals that the client expects to be involved in their treatment. It's important because clients, like we talked about, have a high sense of personalismo and friendliness, and again, the way people defined their family can impact the therapeutic process. Also important to Hispanic individuals is that they may not be able to express a disagreement to people who are in power. So focus on developing rapport. Be mindful that treatment may need more than one person and may include more loosely defined family, and remain mindful of the power that you have as the authority. Metaphors. So this concept refers to symbols and concepts. It's important to know that individual power may symbolize oppression or prejudice to the client, which may impact the therapeutic rapport. Another story that I have is when we were doing chatlas, we were doing these group discussions on immigration with some, out in the community. We had set up a couple different chatlas, and in one of them, we had it at a multi-service center that was owned by the city. The metaphor of what that facility meant to the individual was that it was authority. And so what we had such a low presence with that chatla specifically, And we attributed it to the fact that individuals felt that this was a um, place where they couldn't come to talk about their immigration issues because it was a place of authority. Um, so remain mindful that what mean to an individual. Content refers to the cultural knowledge about values, customs, and traditions. Each client may be influenced by cultural values, customs, and traditions specific to their family, community, and race. Um, Specific modifications. The treatment needs to be holistic and incorporate and potentially incorporate some spiritual or other elements from our culture. We may need to incorporate values, customs, traditions, knowing holidays that are important and straying away from looking on those specific holidays. Um, just really being aware that the cultural content um, is important. Concepts refers to the construct of a theoretical model that is used in treatment. So this incorporates the provider's understanding of the client's problem and involves the client's understanding of the same problem. If they are not on the same page, if there is too much of there may not be some ability to complete treatment goals. So you have to understand the problem the way the client understands it, potentially maybe not the way they're conveying it. Context. So I love this specific one because it has taught me so much of why I believe or why I do some of the actions that I do. So context really considers the client's broader social and economic political context. The context of the intervention impacts the client's priorities and competing tasks. Um, so here we are a high context culture. So overtness of messages, many covert and implicit messages, read within the lines with use of metaphors. Um, it's like, oh, see, yeah, she's great, right? Like we definitely use implicit messages and um, nonverbal communication is so important to us. Um, it's also, I give this example of when I was meeting with my boss, I would always say, why is she, like, for example, why would she say this guy is blue? Like, does she mean that I should be wearing more blue? Does she mean that, like, I would overanalyze what my boss was saying because I am a high context culture, because I was looking for in between the lines. And when she wasn't stating those things, I would have to go back and ask her because I was trying to make something of, I was trying to come up with a story that I was telling myself of the 2 words, 3 words that she was saying. Um, so time of flexibility of time is open and flexible. How many times have you heard, oh, it's like on Mexican time, like invite them at 3 o'clock and they'll show up at 6. Time is very open and flexible. Process is more important than product. So remember that when when they're 5 minutes late. Level of commitment. We are highly committed to long-term relationships. We have strong bonds with affiliation to family and community. Yeah, this was a great lesson for me to learn. Methods are the procedures to follow in order to achieve therapeutic goals. Methods incorporate the theory used, the provision of the assessment, the use of transference, countertransference. The client's experience, expression, and explanation of symptomology is bound to the providers and the client's intersubjective perspective. And on top of that, it is impacted by each of the person's, the therapist and the client's own culture. Hispanic and Latina clients may feel more comfortable um, to methods they're already accustomed to. So, making sure that you can provide um, therapy in a way that is more comfortable. We recognized when COVID hit that we lost a lot of our Hispanic and Latina clients, and they were a lot of no-shows because we were asking them to do teletherapy, and they weren't comfortable sitting on a screen um, and providing that information. Again, goals refer to the identified desired outcome. It should reflect the client's and provider's understanding of the problem and should be specific to the client's problem, attainable for the client by using his supports. And it has to be congruent with their values. Cutting off your mom is probably not going to, even if it may be a toxic relationship, may not be most congruent with the client's values, especially if they believe in Marianismo and Familismo. So here are some therapies that really have worked with the Hispanic Latina population seeking safety. It's an evidence-based counseling model. It's integrated holistic treatment. It uses cognitive behavioral, interpersonal, and case management. And there's also the trauma recovery and empowerment model, which is a group treatment model designed to empower, provide education, and to build skills. Other therapies that can be used, brief strategic family therapy, family support network, functional family therapy, multidimensional network therapy. All these have been proven effective with the Hispanic populations. So with that being said, there's tons of cultural strengths that we have. Many Latinos have a strong support system in their family who are willing to attend relevant appointments and otherwise support the client. Some Latinos may be open to a holistic treatment experience involving spirituality and physical health treatments. If positive rapport is developed, Latinos are more likely to trust a professional and follow recommendations. And research has demonstrated that Latinos are more likely to believe in positive impacts of mental health treatment than their white counterparts. So all that to say, if you don't look like us, if you don't talk like us, empathy goes an incredibly long way with our community. And really trying to stay humble and being, having that cultural humility really is a great standing point for a therapist, especially even new therapists, to be just culturally curious, wondering, asking them how they feel about something, what that means to them. Yes, so we are going to switch over to our quiz time for a $10 Starbucks gift card that will be sent via email that is purchased from me. So I'm going to stop sharing, and I will then share the Kahoot. And we will give you, let's see where, here we go. Is it sharing the Kahoot? Yes. All right. So get ready to join. There should be a pin coming out. Or you can scan the QR code. I think this is probably the biggest Kahoot I've had. It can go up to 300 people. All right, I'm going to give it like 10 more seconds. All right, here we go. We're going to start. This is 6 questions. So integrating culture. First question. How many Latinos live in the US in 2022? And there is one answer. It was 64 million. Who do we have at the top? Great. Okay. Jay is next and Viali. Next question. Percent of counties in Region 4 with at least one mental health facility providing services in Spanish. 15 seconds. Two seconds. 20%. That's not enough. Oh, we just had a completely different change. Cameron, Viv, and Heidi in the top 3. Latinx who did not receive treatment for substance use issues in the last year, 12 years or older. Three seconds. Was 87%. That is such a high number. Oh, Cameron stayed in the lead. Denisha coming up behind. Fourth question. Cultural value of blank is a belief that an individual's future and fate is beyond one's control and cannot be changed. Fatalismo, yes. Marianismo and machismo are gender related, and respeto is respect. Cameron's on fire. Okay. 2 more questions. True or false? Because of the value espiritualidad, spirituality, illness can be viewed as a spiritual punishment. True. Absolutely true. Cameron stays on top. Last question. Multicultural orientation framework consists of the following 3 pillars: humility, opportunity, and convenience. False. It's comfort. Humility, opportunity, and comfort. All right, so who do we have in the podium? We have Heidi. Congratulations, Heidi. Janisha. I hope that I'm saying it right. And Cameron. Cameron, can you please put your email in the chat? All right, so we are going to stop share. And I'm going to put a couple QR codes up for you all. So that way you can take our survey. Also, if you would like to connect with me, here is my LinkedIn. I'll leave it up for a couple seconds. If we have any questions, Eric, can you help me out with that? And then in a couple seconds, in a minute or so, I'll change to the survey.
Diane, thank you so much. What a wonderful presentation and so insightful in terms of what cultural responsive services mean. Really enjoyed it. And I think thank you for bringing these points to our audience. So these QR codes that are here, I've also shared them as a link through the chat, and we can start taking some few questions we may have from the audience. I know that some that are here in the chat already. Um, One refers to susto, which was described up above. Is um, is susto has trauma is as trauma is described. Maybe that's referring to if susto is related to trauma in a way.
Susto can be related to trauma, um, but it doesn't have to be specifically. You know, trauma is perceived differently by people, and I think oftentimes we um, jump to say something's a traumatic event, where it can be an event. It doesn't necessarily have to be a traumatic event that leaves long-lasting um, consequences. But yes, it can be, but it doesn't necessarily have to have a long-lasting consequence. I hope that answers your question.
Thank you, Diane. The evaluation may be flipped. The English one might be Spanish and the Spanish one may be English. So I apologize for that. Spanglish. This is how we sometimes live.
Yeah.
Um,
I'm going to go ahead
yeah,
and change to the next slide so that way you can see our digital presence. Please connect with us here on Facebook, Instagram, and LinkedIn. Any other questions? I know we have about 2 minutes left. All right. Well, I am going to say thank you for your time and attention, and appreciate each and every one of you for the things that you do and wanting to provide better, more culturally aware services for your clients. Adelante, we are growing, and we will be an even bigger and stronger force with individuals like you. So thank you.